Welcome to the Postpartum Performance Podcast. If you're here to be empowered and encouraged, you're in the right place. I believe every woman deserves to learn who's in her corner, which is why this podcast was created, to share encouragement and intentional conversations around women's health, nutrition, and wellness for new mothers. In each episode, we will discuss ways for women to find truth for her health, to feel strong, and to be confident from the inside out. I'm your host, Dr. Lindsay Peczkowski, a performance physical therapist with a passion for teaching others about pelvic health and guiding mothers to build movement, confidence, and strength. I'm a lover of running and weightlifting and a healthy cooking enthusiast. All right, ladies, grab your coffee and settle in for an episode of the Postpartum Performance Podcast. Are you with me? Here we go. Hi, ladies. Welcome back to the Postpartum Performance Podcast. Today, we have a treat for you. We are going to be talking a lot more about pelvic health and pelvic health physical therapy and what that actually means. Today on the show, we have a friend of mine, Beth McCarthy, and we talk all about what's common but not normal when it comes to pelvic health. And we focus a lot on postpartum health and pelvic health for the long term. So here's a little bit more about Beth. She's an active mom of a 3-year-old boy and a 1-year-old girl. She's the doctor of physical therapy and has been practicing for 8 years and has been practicing pelvic health for the past 6 years. She's worked with a variety of pelvic health dysfunctions for both men and women, but her main passion is pregnancy and postpartum moms, because remember, postpartum is for life. She loves educating fellow moms about problems that commonly occur but are not normal, the new workout challenges of parenthood, and what to expect during and after labor and your new body after baby. Prior to kids, she was dedicated to long-distance running and did cross-training regularly. These days, she still runs, but it's a bit more sporadic. She also enjoys spin classes. Her time is precious, so whatever workout she can get in for the most bang for her buck, she's going to do. Ladies, this was such a wonderful conversation. We have some really good, honest truths about some of the topics regarding women's health and focusing in on the pelvic health. And I really hope you enjoy the show as much as I did. So without further ado, let's get to the show. Welcome back to the Postpartum Performance Podcast. Today we have Beth McCarthy on the show. Welcome to the show, Beth.
Thank you so much for having me.
I'm super excited to have you here. For listeners, Beth and I used to work together in North County, San Diego area a few years back. So really fun to get connected again, and especially with our specialty in women's health. It's going to be a really good conversation today. So looking forward to it. First thing, Beth, why don't you just share a little bit about yourself? Because I know you have a lot of expertise in the physical therapy world, but also just who you are, a little bit about personal, and then a little bit about your professional life.
So I'm a mom of 2. I have an 18-month-old little girl and a 3.5-year-old little boy. They keep me very busy. I work full-time in an outpatient PT clinic. I have about a 90% caseload of pelvic health. I treat both males and females, but I'm super passionate about postpartum care. I, like I said, have an 18-month-old, so I'm postpartum. You're pretty much postpartum for life. Your body is different and changed after you have a baby. I was not, I've been a pelvic floor PT for probably like 6 years, but I was passionate about it, but I feel like once I had a baby, it just like was like this aha moment of like, oh, this is what it's really like. You never really understand until you've gone through it or gone through something like that. And it's not a negative thing. It's just a different perspective on things. And it kind of helps me grow as a therapist and have different understanding for patients, especially that postpartum patient.
Awesome. And you are now up in what area of California?
I'm in Clovis, California, in Central California. So we're about an hour from Yosemite, which is really nice.
Yeah.
We have lots of fires here right now, which is not so nice.
Oh, stay safe. Yeah, all those Central California people, if you're looking for a pelvic health PT, Beth is your girl to see. I know she's been super busy, though, recently.
That's all right. The more the better. The more people I can help, the better it'll be.
Exactly. Get the word out. So today we're going to focus on kind of what Beth touched on, is like postpartum care and pelvic health. There's so much that can be talked about. There's so many things that haven't been talked about. But we wanted to kind of just touch on what's common but not normal in the realm of women's health, because there's a lot of stuff that people will talk about, but they think that that's just a part of being a mother or a part of after having a kid, and they think that's just their new normal. So I would love for you, Beth, to, if there's something more that you want to elaborate on that, potentially some diagnoses that you see a lot more of.
Yes, that is probably one of my biggest pet peeves, and I was guilty of it as well. My mom peed her pants after she had a baby. My grandmother peed her pants after she had a baby. Like every time they laugh, they pee their pants, and they just think, okay, this is just part of having a baby. And it's super common. A lot of people have it. I had incontinence after both of my children, and I'm a pelvic floor PT, and I knew what to do, and I still had it. And just thinking that it's normal because a lot of people have it, and it's not. And there's definitely something that you can do about it, and you can do something about it 25 years later, and that's still okay, and we can still make a change. It doesn't have to be, well, I missed that window of 6 weeks or 3 months or the first year postpartum. It's something that you can make a change on later on. And I think the incontinence one is probably the most prevalent one that I see of, oh yeah, it's like no big deal. I just pee whenever I sneeze. And that's like that for 25 years. And I'll have people coming in for chronic pelvic pain, or even like a low back pain or a hip pain for orthopedic issues. And I'll ask them, the question, do you have any leaking with coughing, laughing, or sneezing? And they're like, oh, well, of course I do. I have kids. And I'm like, no, it doesn't have to be that way.
Yeah.
Biggest one. And then you see, TV doesn't help. You see commercials for Poise underwear, and they're just like, oh, leaking is just part of being a woman. Here's these beautiful Poise underwear, and you can just wear these for the rest of your life. And who wants to wear an adult diaper forever? Like, you can do something, and you don't have to wear an adult diaper. Now, it's not like I'm just going to put this machine on and I'm going to be healed. You have to work at it. It's a muscle. Your pelvic floor muscles are like a hammock muscle that support your organs. And you need to work on those just like you would need to do, bicep curls to work on your biceps or anything in the gym. But you can eliminate it completely, even with jumping on a trampoline. I'll never jump on a trampoline. It's okay. But you can if you want. You don't have to limit yourself because of this incontinence issue. And that's probably one of the biggest ones that the common but not normal, that people just think that it's normal because they talk to other people and it's okay to pee your pants, and everybody does it, so it's normal, but it's not.
Yeah. And I think there's a big part in the US, especially, that has been, it's interesting when it comes to postpartum care and pelvic health and some of those things, because it's not as prevalent as it is in some other countries. But also for the fact that I think a lot of women just don't know where to go. And so, or they don't know that it's a thing. When I started doing more training with, like, through Herman and Wallace and stuff like that, and like sharing that with friends or family, and they're like, wait, what are you doing? And so trying to explain that, like, there is a specialty within physical therapy that focuses on pelvic health, and postpartum specifically for me, I'm more passionate for that. Again, I'll treat anyone, but postpartum and kind of return to exercise is my big thing. But because Beth, you had a good kind of like statistic or like or thing about the world, like in other areas of the world and their postpartum care and how that's different to us. You want to share on that?
Yes. So in most countries, most developed countries, it is normal for 6 weeks postpartum for a new mom to go and see a pelvic floor physical therapist. Whether you are having incontinence, whether you have pain or not, it's normal because we actually do a full assessment on your pelvic floor muscles. I had a wonderful, wonderful OB down in San Diego. Like, if I have more kids, I'm going to go to San Diego to have a baby. I had a wonderful OB down in San Diego, and they don't check your pelvic floor after you have a baby. You come in 6 weeks, and they're like, hey, how's it going? They're trying to check mental health, making sure you're okay as a new mom, you're handling it okay, because it's a big change. And, are you having any of these things? Like, okay, well, this will go away, and if not, let me know. But they never ever like did an internal check or even like looked down there, where is because I had tearing after my first baby. And they just don't check, and we will do that full assessment. people have sometimes episiotomies or like a grade 2 tear, grade 3 tear, even a grade 1 tear, and you have a couple stitches. And anywhere else, if you cut like the bicep to help something like, come out, you cut the bicep, there's no way they would sew you up and send you on your way. And at that 6-week mark, just be like, oh, hey, how's it going? They would, number one, look at your stitches. They would check your range of motion. They would see if you can contract your muscle or not. And with pelvic health, it's like, I don't know where the ball got dropped, but they don't do that. So most countries, normal postpartum, 6 to 8 weeks to see a pelvic floor physical therapist. In the US, we're just lacking on that. And I'm super passionate about getting that awareness out there to either new moms or doctors. Some doctors are very receptive to that, and they're happy to like, okay, I'll just send. But otherwise, going and talking to new moms, they know to ask for it. And it's unfortunate that they have to ask for it, but ask for it from their doctor, like, hey, can I go see a pelvic floor PT? And then knowing how to find a pelvic floor PT. Because a regular PT or general orthopedic PT is not going to look at the pelvic floor.
No. They won't feel comfortable, most likely.
Yeah, and that's okay. That's why there's a specialty in that realm. And so I think Herman and Wallace has a great website they started, and it's www.pelvicrehab.com. You can just put in your zip code, and it will pull up an area or a whole bunch of pelvic floor PTs in your area or the closest to you, and then you can call and go from there. And in California, we have direct access. And so you don't even have to get that referral from your OB to come in. So if you're having problems, or even if you're not, and you just want to be checked to make sure that you're not going to have problems down the line, that's a great thing to do, to go on there, call. And we won't usually see somebody before that 6-week mark because you're not cleared to do things until there. And if you have a C-section, it's 8 weeks. But we're not going to take you sooner than is okay for you to be checked out.
Exactly. Yeah. And if you guys do check and there's nowhere, if for whatever reason, there's so many pelvic health therapists out there, but if you check the website and there's not anyone near you, reach out to myself or Beth. I'll have our contact info here. And we're in a lot of different Facebook groups too. And so sometimes if we just shoot a message in there, we can find some other people in other areas. So knowing that there are options, and to empower yourself to know that you have options for care that you deserve.
And some people do virtual visits.
Yep.
And it's hard 6 weeks to get out to go see a doctor. Like, I remember going my first time with my first child, 6 weeks, and trying to carry a car seat. And it took me like 2 hours to get in and get out. And I was like exhausted and sweating. And I was like, what just happened to me? I just carried a baby 20 feet. And you're already tired and you're just trying to get yourself into like a new routine. Even if it's something that you can start doing at home on your own, after you see one of us, like, it can be so beneficial and so helpful. And, like I said, preventing things from happening 20, 25 years down the line, or preventing something or stopping something that is going on now, because it's not pee your pants after you have a baby. It's not normal to have what's called the diastasis recti, which is the separation of your linea alba in your abdomen, where you get like this doming or tenting in there. That's not normal. That should go right away, especially around that 6-week mark. And it's not normal to continue to still have pain, like with bowel movements or when you're returning to sex. And common things that happen after you have a baby, but can be easily fixed.
Absolutely. And to touch on some of that, because I know all of those, a lot of the times there's a combination. It's not just one thing. Sometimes it is, but as you're working with a pelvic health therapist, we're looking at the big picture as well. We're not just looking at your pelvic floor, or at least I think a good therapist looks at the bigger picture, but you're looking at more than the pelvic floor. So I know sometimes people will get a little like nervous about like, well, what are you actually doing during pelvic floor physical therapy? And that might be our focus, that maybe there's weakness there, maybe there's dysfunction there, or lack of coordination, or if there's scar stuff that we're working with. But we're also looking at the big picture of like your dynamic core system, because that's where some of that diastasis, that low back pain, the incontinence, like all of those things come into play. And so I just want to make sure that people are aware that when we're saying like pelvic health and stuff, it's not that we're just like spending time around your pelvis. Where, we can, and we will, if we need to do any internal stuff and external stuff. But to also let people know that there's so much more that goes into that pelvic health PT thing. Beth, I'd be curious, what would be because I think a lot of people think postpartum and they're like, okay, so I had a kid a year ago and I'm still kind of in that postpartum. But what about those mothers that they're listening and they're like, yeah, my kid's 20. Like, like, what do you mean postpartum? Or like, I'm not like, some people don't classify themselves as postpartum once their kids are a little bit older, which is, valid. You're not immediately postpartum, but what are some things that are common, or that's that long-term that at the time after having a baby and then down the road can kind of play a role in just overall health?
So I see a lot of people who had C-sections and their C-section scars like 20, 30 years later are so bound down. Now they have this like chronic constipation or chronic pelvic pain, pain with sex, pain with bowel movements. And it's like as simple as a C-section scar mode that you can still do 20, 25 years later, and you can get results with getting that to loosen up. And all of a sudden it's like, oh, I don't have to take X-Lax to have a bowel movement on a regular basis. I can actually, do things regularly now and have a regular bowel health. That's a big one that I see. And it was something as simple as C-section scar mobilization. Mm-hmm. And I know how to do that themselves. And sometimes they had, 3 or 4 babies, and that C-section scar, like they keep going in that same one. So it's really bound down. And I'm thinking after 4 surgeries, like you should have seen somebody, but that's okay. So that I would say, the diastasis recti is a big one because it's something you might not even notice. Like maybe the separation is like only this much versus this much. And so that's a lot more noticeable. And if you don't actually train your transverse abdominis muscles to bring that connection back together, that doesn't automatically come back for some people. Some people it does, but some people it doesn't. And so you have this chronic low back pain that you've had for 15 years, 20 years, and it's on and off. It's like it comes and then it goes away, and then it comes and then it goes away, and it comes and it goes away. And I've done PT and, it helps for a little bit, and then it comes back. And then you check for that diastasis, and they've probably had it since they had a baby. And you work on that and start reconnecting that tissue, because it can be 25 years later and it can still get some of those connections back to give them stability. Otherwise, you're setting yourself up for chronic back pain for the rest of your life.
And to touch on for the diastasis stuff, so Julie Wiebe is a great PT in the LA area doing a lot of research on diastasis rectus abdominis stuff. And she's really been making a really big push for women prior to having kids to check what your like diastasis is prior to having a child. Especially if you're an active individual. I know a lot of CrossFitters actually can develop it as well. But the fact is, if you don't know where you're starting from, you may have had a mild separation or just how your body was. And then you have a child, or like during your pregnancy, you're like, oh, I'm noticing some like separation, which 100% of women that have a baby that are pregnant will have diastasis. That's just like the anatomy of it. Like it just happens. But
baby has to go somewhere. Your belly has to grow.
Exactly. So it has to be functional though afterwards. And that's really what the PTs, what we're making sure is that it's functional. And so Julie has some great stuff of just be aware of like where you're at before, and then after, then you at least have a baseline to go from, or even between pregnancies. So if it's your second child or your third, knowing where you're starting from, because then you at least have a little bit of a gauge of like, oh, this is pretty much the same as before, or if not less, or it's more. You're like, okay, now I know where I'm coming from. Because I think that can be really overwhelming for some women if they, prior to having kids, they're like, oh, I didn't have anything. And then after this kid, I have this huge gap. Or they might have had, a little bit of a separation, and it was functional and it was fine, and it was okay. But just to know that, that is a possibility, and just to know where you're starting from, just like with anything else, know your baseline with that.
For sure. And I think even knowing what to do to not make it worse right after you have a baby.
Yes.
Because your baby is now waking you up 6 times a night and you are just like popping up out of bed. And then you're like carrying a kid and reaching for things and doing all these things. And so you're actually making it worse without even realizing it. and even belly binding and things like after you have a baby, things that can help a little bit to help that come back together or to help prevent it from getting worse until you can start doing exercises and start treating that.
Mm-hmm. What would be your top one or two things that you would tell a mother? She's like 8 weeks postpartum and noticing some like coning or doming. Where would you have her start?
I have them, so 6 or 8 weeks. So sometimes I'll still have them put on like a belly binder. And then log rolling is a big one. Yeah. Changing their breathing with everything, with bowel movements. Everybody bears down and then you're actually just making it dome more. And then starting with some very, very light, like transverse abdominis stuff. And I, even postpartum and being a PT, my muscles didn't fire. And I had trained them during pregnancy and they just were like gone. And I would sit there and palpate and I would have to make this sound to try and get my transverse abdominis to kick in. And then I would fall asleep like midway through because I was exhausted. And then I'd wake up and do a few more. And so I think that's the biggest thing of like changing how you're getting in and out of bed or how you're lifting your kid, especially like reaching into cribs or pack and plays or whatever bassinet. Like you're laying there and you're exhausted and your kid's waking you up for like the 6th time that night and you're laying there. And so you just kind of reach over like this to pick up your baby to breastfeed or to like roll on your side and breastfeed, or you're sitting up. Now you're sitting up with extra weight there. And so that's just making that separation worse. And every time you dome, you're pulling that tissue apart. And so you can try and avoid that doming by knowing what to do, either doing a little transverse abdominis contraction before, doing a log roll with it. And it sucks to have to like get up and like get closer to your baby to pull them over, but it's going to prevent problems later. And it just takes an extra second. It's just to do it, but it's little things like that and changing that habit before it becomes a big issue.
Mm-hmm. We're totally creatures of habit. And it's the small things that I think are the most important, especially when it comes to recovery postpartum, is that it's the things that you're consistently doing over and over and over and over again. The feeding, the holding, the lifting, the stuff that you have to do to function. But if you're doing it in a not optimal position, or your strategy of like pushing air out through your stomach or pushing out a bowel movement, if you're consistently doing that over and over and over again, that's going to impact your recovery. But then also, like Beth was mentioning, long-term down the road, if even from childhood and on, like if people have like, for example, the constipation one, that's something that if you're constantly pushing, people don't necessarily realize that over time, if you've been doing that for 50, 60 years, that's a strategy that your body has just developed and really ingrained in. Every time I go to the bathroom, this is how I go to the bathroom. And we might need to try, like, let's try it a different way. Let's try breathing a different way, because unfortunately, just like with any other part of our body, if we're continually doing something over and over and over and over again, something is going to have to either compensate, or something's going to break down, or something needs to be addressed, and like getting to that root cause. So women's health stuff is very much like that, but also in the fact that there's so much that contributes with, whether that's stress management, sleep management, like there's so, I think is what drew me to pelvic health stuff too, as well, that there's so much that can be touched on in general. Beth, what would you say? So working in women's health and seeing about 90% caseload, I'm sure you have heard many a times, even within just general PT, but especially with women's health, when people are like, I wish I would have known this sooner, or I wish I would have found you sooner. What is that topic, and what would you say to hopefully get the word out so that these people can hear this sooner than later?
Yeah. I think the biggest one is they're surprised that so many years later you can still stabilize things. Like, it's not a lost cause, even if you didn't do it 10 years ago and your kid's now 10 or in high school. The big ones that we've already talked about, like that diastasis or that incontinence, even pelvic organ prolapse, of like catching it before it's a grade 3 or a grade 4. And so I wish I would have known, like, hey, I should have gotten a squatty potty, or hey, I should do a belly big, belly hard when I have a bowel movement, versus just bearing down. Because when you're bearing down, your pelvic floor muscles are here and your diaphragm's here, and you're bearing down and you're doing this, and you're trying to fight those muscles to get that bowel movement out. And you're increasing all that intra-abdominal pressure, and it's going to go somewhere. And whether it's going to go through a little bit of a diastasis that wasn't there, or your pelvic organs are just going to go pop. And I've had so many people that are like, yeah, I was having a really hard bowel movement and I just felt something drop. And now I have a pelvic organ prolapse. And it's like, you probably had it before, and we could have changed how you did this so that that didn't get worse, or that didn't cause now not just your bladder, but now your uterus, or now you have a rectocele where that rectum's falling in there. And so I think the biggest is, like, I wish somebody would have told me this before, of changing how I have bowel movements, or changing how I get in and out of bed to prevent these kind of things. And I hear that a lot. I definitely hear it a lot. Or how long have you been here? No, we didn't know you existed. My doctors told me that there was nothing wrong with me. They're going to send me to psych because they think I'm crazy. I've had this chronic pelvic pain for so many years. And just getting the word out there that pelvic health PT it's something that we can help. And I treat males just as much, well, probably half of as much as I see of females. And men just don't talk about it either. So, like, a lot of people are like, oh yeah, my husband sits in the toilet for 35 minutes. Shouldn't take 35 minutes to have bowel movement. 5 to 10 minutes. Abort mission.
Abort.
Come back at another time. But again, something that you can do about it. You can do things about that. And so I think the biggest is, like, those guys of, I wish I would have known this sooner, or I wish I would have known where to find you. Yeah. Because doctors don't even know. I would say the newer doctors do know a little bit more about pelvic health, and some of the old school doctors are open to it, and some of them just think that we don't know what we're talking about. And I mean, we have doctorate level education and then continuing education to specialize in this, and there's certifications, and it's not I read a book and I know what I'm doing. It's we practice on each other. I've talked to physicians and they're like, you know, and you're explaining what you do, and they're like, oh, so how do you guys get models for those classes? And I was like, we don't have models. We practice on each other. Like, we know what it feels like to have this done. We know what it feels like to have these muscles palpated, and what it should feel like and what it shouldn't feel like.
Exactly.
Done it on multiple people, on each other in classes, instead of just having a model who says, oh, what do you think this is? You know, this is this. And they're like, well, you have no understanding of what you're actually doing. Yeah. I mean, not that they don't know what they're doing, but you know what I mean?
Yeah.
We've gone through it.
Yeah. And I think that's something that I love sharing with the patients that come in, is that, like, I can relate to them. And especially when I think this pelvic health stuff can be really vulnerable and really stressful and just different for a lot of people, and they're just not sure what to expect, and just letting people know, like, I've, you know, the training that we've had done, like, I've been a patient, or like on the other side as well. And being able to let people know that it's okay. And I think having it not seem as scary as it might appear to be, or, and also knowing that everyone has the choice to say no for an assessment with any of that, and that there's still ways that we can gather a ton of information. So I always like making sure that people are aware of that yes, doing that internal pelvic floor muscle assessment and, like, screening for pelvic organ prolapse and all of those things can give us so much information. But if someone's not comfortable,
okay, there's still plenty of things that I can do.
Exactly. We're not going to force anyone, because you know what? It's more about having you feel comfortable and helping you grow and feel empowered to address the symptoms that you have. And we're trained to have different strategies. Everyone is different. Everyone's symptoms and all of that, there might be some commonalities, but we're going to approach it differently based off of your symptoms, your situation, and kind of where you're at. We're going to meet you where you're at.
Yeah.
Which I think,
that's a huge one of, like, you don't have to come in and be fearful that somebody's going to do an internal pelvic floor assessment, because I may or may not, especially, like, as I get all of the information that you're telling me, I'm like, okay, this doesn't sound like it needs actually an internal pelvic floor assessment at this time. And we have so much other information to get to. Let's give you this information because maybe you're 6 weeks postpartum and it's going to be another month before I can see you. So let me give you something that you can start doing at home. And you can work on it until you're ready to come back, or until you have time to come back, or until you're comfortable with that. And if you're never comfortable with it, that is 100% okay. Like, I get it. But it's also going to be a heck of a lot more gentle than going in for your annual pelvic exam of your pap smear. Speculum. I always use the example of, like, this is what a healthy muscle feels like when you touch it. I may find some muscles that are a little bit sore. My palpation is not going to be any harder than that, but we can figure out what's going on. And then I have models too. And so I think that's a big one of, like, this is what I'm going to check. This is where I'm going to be palpating. If you're okay with that, great. And if you're not, that is great as well. And you can change your mind at any time. I won't be upset. I won't be offended. And if you never want me to check internally, again, that is okay. We will work on everything that we can work on. And I have to say, abdominal fascial mobility, huge. Like, more than I ever thought. How many restrictions you can have. And when you're working on something, they're like, oh, I feel that down in my pelvic floor. And it's like, yeah, there's a huge connection. It's like wearing a blouse where it's kind of tied down here, and you reach up your arm and you can't lift your arm all the way because it's limiting. Yeah, so if you have a restriction, that'll do the same thing to your pelvic floor. And it's, maybe you had an appendectomy when you were 5. Yeah. And it never bothered you, or hernia repair, or any kind of laparoscopic surgery, or even none of those, but just something that happened and it's bound down. And so if you're not okay with internal work, that is totally fine. I'm not going to pressure anybody into doing that.
Yeah, I think it's a cool thing to have in our toolbox, but something that we have many other things that we can do, which is good. All right. So I wanted to transition into, so this podcast was also about health, wellness, all those cool things. And me personally, I love exercise and fitness, and I know you do as well. So what exercise or movement are you doing now, and what exercise brings you joy?
I mean, everybody's, social distance, and gyms opened up in our county, but with 2 small children and a full-time job and a husband that works an hour away, it's hard to go to the gym. And so I really hadn't gone to the gym since I've had kids. But we did buy some home gym equipment. So I do have a spin bike.
It's a great setup too. They have like the cute little I
have a little box thing that hangs my shoes and has Lysol wipes and headphones. It's like better than asleep. I can still blast the music because I really like to work out to very, very loud music because I need to tune the rest of the world out.
I love it.
And so I have a spin bike. I do like apps, like on Peloton apps of like their yoga classes and things like that. Because that I can do with a headphone on and a TV on when my husband's watching TV in the evenings. And like we can still kind of hang out even though I'm doing my own thing, but I can sit there and do that. That kind of stuff. And then really, if I can go for a run, that's ideal. But I've run maybe 3 or 4 times since my daughter was born because I just don't have the time. I peed my pants the first 2 times I ran and I was mad. And then I thought, all right, I need to be a better patient and start working on this. So then I actually went for a run last weekend and didn't pee my pants.
Woo! That's awesome.
So, but those guys, and then really just how you change your workout routine now. Like I run around the kitchen with my kids probably 3 times a week. I am back to my pre-baby weight for both kids. And I mean, just playing with them. I carry them, run around the island. We dance around. And it's okay if you don't get 30, 40 minutes in straight. Like if you get 10, 20 minutes and then a baby cries and you have to go do something or you have to pick something up, or my kid peed all over the bathroom the other day and I had to go clean that up and then we continue after. And so changing how you do that. And that's the hardest thing because I'm kind of a control freak. And I like to do things like, I don't like to stop midway, but accepting that as like your new norm, and that still counts as a workout. If you did 10 minutes running around with your kids, and you're carrying a kid running around, like it's hard. My daughter's like 23 pounds and my son is 30. So, and I only weigh less than 120. So I have 50 pounds on my body running around jumping, and I didn't pee. And that's definitely a workout in itself. And you have to like take those guys as a win because trying to find that routine is hard. And it's doable, but you have to be super dedicated. And I would rather hang out with my kids or play with them than go and be gone. So it's like, I'll do it while they're on a nap or before they get up in the morning. And if I want to sleep in because I'm tired, I do that, and I'll just run around and play with them later. So I think that brings me joy, and it's a workout. I'm sweating. I'm sore. That's the next day. I'm like, why am I so sore? And it's like, oh, because I ran around with 50 pounds in my arms for 25 minutes. Mm-hmm. And we jump and do obstacles, and I have a niece that comes over, and we work on our gymnastics, even though I'm out of my gymnastic phase, but even like doing that, it's a workout. So accepting that like you may not get a good 30 minutes straight, but you may get 10 minutes and then 5 and then another 10, and you take little breaks in between because your new priorities have shifted that, and that's okay. It's hard, but it's totally okay, and it still counts as your workout, and don't beat yourself up if that's the case.
Absolutely.
That's the biggest one.
Yeah. And I think the thing about changing the perspective on what you're doing, where like play is exercise, I think yes. In society and in like getting into our like work mode and adult mode, that we almost feel like we have to do something that's like more organized or more like set on a certain thing. And like playing with your kids is actually like really functional, because you have to get down on the ground. You have to get up off the ground. You have to change your speed. You might have to quickly grab them before they like run into the street, or different things. That the play allows your brain to work differently too, and being more creative and an outlet. So I love hearing what other mothers have, kind of how they've shifted or like pivoted their fitness, because especially if it was an important thing to them prior to having kids, what does it look like after having a child? Because it's not something that it has to go away. It just might look different, like you said. And the play stuff, the kids love it.
Yeah. And I love to run, but I love my kids, but I do not like running with a stroller. It is the worst thing in the world. It is so hard. It is so hard not to be able to move your arms. So hard to have an arm here. And so it didn't bring me joy anymore to run with my kids. And so if I can go by myself, great, but I don't have that opportunity or that option as often, and that's okay. So then I just changed it. Like, I'll run with my kids, but we're going to run around the house, or we're going to run laps in the backyard. Mm-hmm. And, you know, and we sometimes play freeze tag with it. And, or we sometimes will, you know, jump up onto a box and then run back down and do obstacles. And it's much more enjoyable for me. I'm still getting my workout in, and I'm playing with my kids. And then I feel like I didn't have to sacrifice one over the other. Mm-hmm. Some days to just go and be away from them and run by myself. I can like be a better mom that way, mm-hmm. but it just doesn't happen as often, and that's okay. Maybe I get to do that once a month or once every other month or something like that, but I'm still getting those workouts in during the week. And it's just so much easier to do it when you're, you know, before dinner or after dinner while dinner's cooking. We can run around and play and kill that time, and I get to spend that with my kids.
That's awesome. And I think really encouraging for a lot of the working mothers out there to know that it's doable, and just finding what that looks like, I think is great to hear. Because I think sometimes we have the idea of maybe someone that their schedule or their commitments look differently. And so then you compare, but to know that everyone has a different kind of situation that they're coming in from, but making the best of what you have, whether that's time or whether that's location or any of those things, or equipment, and just being creative with it and making the most of it. So very encouraging, Beth. I appreciate that. I'm sure that listeners will as well. So I wanted to also, based off of that, and we kind of touched on a few things, but this is one of those questions that I love asking, especially for mothers, because they've been through it, but also as a pelvic health therapist. So let's say you're at a coffee shop. I know you loved Better Buzz when you were down here. I don't know if there's a new coffee shop.
I order Better Buzz, and it's shipped to me in Clovis. And
you are perfect then. Perfect. So you got your Better Buzz.
There's a great place here called Cup of Joy that's really good too.
Oh, perfect. So you're in line at Cup of Joy, or you happen to be having some Better Buzz, and there's a new mom that comes up to you. She's, you know, got her child in the little like carrier, and she's like, "Hey, Beth, I have a question for you. I just had a child and she's probably, maybe their child's like 1 year old. So not immediately postpartum, but like 1 year old or so. And she's like, you know what? I'm really struggling with staying healthy and fit and finding a new routine as a mother. What advice would you have? And you have about 1 minute to share because then you got to get off to see some more patients.
Yeah. Finding a new routine is probably the hardest, but just taking a few minutes for you, whether it's you working out with your kids or working out alone, even 10 minutes, and find what works for you is probably the hardest balance to find. And it changes when your kids change and they sleep better or sleep different. But paying attention to what you eat. For example, I eat standing up because I'm running between kids all the time. That's not the right answer. You should be sitting and actually like meals. But finding what routine works for you, and it's hard, and you might try it this week and it's not working, and you try something different and you try something different, and there's so many options. There's so many like awesome apps that you can download and things you can do at home without any equipment that take 20 minutes. Like there's BBG. I don't remember what that stands for, Bikini Body Guide. And she does all of these, she's from Australia, and she does all of these just body weight things, and it's 7-minute rounds, and it's 4 7-minute rounds. So what's that? 21 minutes. Mm-hmm. So if you can find 21 for yourself twice a week, that works for you. Whatever you can find, and it doesn't have to be that structure, I think is the big one. You don't have to go to the gym to go get a workout in. You can do things on your own at home, and it's hard to find that motivation. So find what works for you. A friend that you can, say, hey, I did this, or like the Apple Watches. I like see other people who like do a workout, and then I'm like, man, I'm a slacker. I need to do something.
Good motivation.
Those are helpful. Yeah, those are my motivation, because I'm like, man, I haven't done anything. This girl has kids too, and she's done it every single day. I'm like, all right, I gotta show somebody up, or at least make.
Not competitive at all, Beth. Never.
Yeah, I have a little competitive streak in me, so it's hard, but you'll find it, and just keep trying and try things, and you may fail with them, and that's okay, and just keep trying. And it may be up and down. Most things in life are, and it's okay if you don't just continue consistently doing it.
Mm-hmm. I love that. Yeah, that is such good advice, Beth, for listeners, whether they're postpartum, because I think that's a big thing, because it's a new life transition, or in any life transition, or just looking to build a new habit or live healthier. So it's the process more than, and like the journey more than the actual destination. Absolutely.
Yes.
Very awesome. All right, Beth, if someone wanted to get a hold of you, where's the best way to find you? Because I think if they obviously live near you and would want to come see you, or just have questions or anything, or want to kind of dive in deeper on any of the topics that we talked about, where's a good place for people to reach out and find you?
So I work for Pro PT in Clovis, California. We have multiple clinics in the Valley. I'm the only pelvic floor PT there. There's one other pelvic clinic in the Valley, but I'm at Pro PT. So easy way to get a hold of us is go to Pro PT's website. It's pro-pt.net. Otherwise, you can always email me, beth@pro-pt.net. Even if you just like have a question, hey, is this something that you could help with? That's a really good way. Otherwise, pelvicrehab.com, you can find me there as well.
Perfect.
But I'm right in the heart of Clovis, near Clovis Community Hospital. And so really easy to get on, like into the clinic, just off the freeway. I mean, everything's easy to get to here. There's not crazy traffic like San Diego.
Mm-hmm. Yeah. So. That's so true. Awesome. I will tag all of those in the show notes for listeners, so they can just click on that and follow those links. Anything else that you would like to share on pelvic health? I mean, I'm sure there's a gazillion things, but any last words of wisdom?
I think that just knowing you don't have to live with that. Like, if you had tearing, it's awesome to get it checked out before you have your next baby, because we can help with that perennial stretching too, so that you can maybe not tear as much or have no tearing the next time around. And it doesn't have to be scary to have a vaginal delivery after having a tear, or a VBAC for that matter. After you had a C-section, we can help with some stuff. Even I do a lot of stuff with like learning different positionings during labor and delivery to kind of educate a pregnant mom of ways to help prevent a C-section. Sometimes it's not preventable, and that's okay. But knowing that that's an option too. It doesn't have to be that you have an issue. You're pregnant, you're going to have back pain, things are going to happen, but we can help with that. And that's normal during pregnancy, but we can also help reduce that. And so that's a good one of knowing that like, you don't have to just wait until after you have a baby to come see us. Like I treat many pregnant women during their pregnancy and help with that kind of stuff. And even giving you breastfeeding tips after like positions so that you don't get this crazy neck pain or shoulder pain. Because now you're sitting stuck in a chair looking at your beautiful baby, but for hours and hours at a time. And so we can help with that prevention and that like just education in general to help ease things along the way, because things are going to be uncomfortable, but we can help you so that you can either understand why or what you can do when you're in that situation.
Absolutely. That was a great way to sum up. I think we're in your corner. We're in your corner, ladies, yes. And we're here to help.
100%.
Awesome. Well, thank you so much, Beth, for being on the show today. I appreciate you and all that you're doing for our profession and for the men and women in need of pelvic health services, and just sharing your knowledge and insight. I think we could have talked so much more on so many more things because there's like so many different avenues you can go down within the pelvic health stuff. So it was a really fun conversation to be able to have you on the show.
I appreciate you having me, and I love talking about it. So anybody has questions, don't hesitate to ask. I'm always here for information and to help guide you in the right direction.
Awesome. Thanks, Beth. And we'll see you soon.
All right. Good to see you. Thanks, Lindsay.
Mm-hmm. Thanks so much for listening to this episode of the Postpartum Performance Podcast. I appreciate you taking the time to listen, learn, and grow. If this is your first time tuning in, thank you so much for being here. The aim of this podcast is to provide oodles of the best possible content to help empower women, eliminate the phrase, "I wish I would have known sooner" around pelvic health, and to encourage personal growth through the postpartum journey to becoming the best version of yourself. If you enjoyed the show and found the content helpful, please remember to subscribe to the podcast and leave a 5-star review. These subscriptions and reviews help other mothers discover the podcast. If you're a regular listener, thank you. I encourage you to tell a friend about us or post on social media sharing your favorite part for today's show. If you're looking for more content like this, please follow me on Instagram at Postpartum Performance. Remember, mothers, if you're seeking to live life strong, I'm here with you in your corner. Continue to be brave, stay strong, and live confidently.